to auscultate heart and lungs of a canine patient, what we're going to do, first to listen to the heart, we're going to listen to the left side of the chest, and you want to listen for where it's the loudest, and usually it's right about the point of the elbow on the left hand side. And we're going to listen to that, and if we're counting for respiratory rate, we're going to listen for 10 seconds, and then we're going to multiply that number by 6. And I'm just going to take a listen, and then we're going to count the beats that we hear. So his his heart rate is around 120 right now, which is good for a post-anesthetic canine patient. The other things that you're listening to as you are listening to his heart, you're listening to the rhythm to make sure that everything sounds good. You also want to feel for femoral pulses as you are listening. So I'm going to do that now. What you want to do is make sure that for every heartbeat that you're hearing, that there is a corresponding femoral pulse or digital pulse wherever you're feeling. And that means that there's no arrhythmia. If you notate an arrhythmia or you feel a weaker pulse than should be, then you want to notate that to the doctor. So we're just going to quickly make sure that there is a pulse for every heartbeat we hear. And there is, slightly after the heartbeat, there's a pulse that is felt back on the femoral artery, so that is good. If there is any extreme tachycardia, bradycardia, or any other rhythm that is not normal, then you would also take that to the doctor's attention. So the next thing that we're going to do is we're going to get a respiratory rate, and then we're also going to listen to the respiratory sounds. So usually when I get a respiratory rate, I'm actually going to watch the dog instead of listening to the dog. What you're going to do when you're watching the dog is you're just going to watch the chest expand, okay? And you're going to do the same thing. You're going to do that over 10 seconds and then multiply that by 6 to get your respiratory rate per minute, okay? When you're watching, you want to make sure that there's not extreme abdominal breathing, it's not shallow breathing. You want to look for fast or slow respiratory rate, open mouth breathing, panting, things like that, things that could indicate a problem. When we listen for our patients or at our patients, we want to make sure that we're not hearing crackling, wheezing, things like that, or signs of upper respiratory issues as well. Those things would all be brought to our doctor's attention. The other thing to note is that when we're listening, we want to listen to both sides of our patient's chest, both to hear if there's a murmur in the heart, but also to listen to both sides of the lung lobes to make sure that there's not crackles on one side of the chest and not the other. Okay, so we're going to listen to both sides of the lungs as well as both sides of the heart right now. Okay, so no murmur, no crackles, no wheezes are heard. He started whining a little bit while I was doing that, so I did hear a little bit of referred noise back, but other than that, I didn't hear any abnormalities in my auscultation. So everything still checks out in his post-surgical checks here. So I'm going to notate that in his chart, and we're all set. Thank you. So to clean Burrito's ears, I have my all-purpose ear cleaner on a cotton swab. I'm going to deposit that ear cleaner inside his ear. I'm going to massage the base of the ear. to break up any remaining wax that's left over from his ear infection. I'm going to take small pieces of our rolled cotton, and I'm going to use that and my index finger to remove any built up wax or debris or infection and get inside the crevices, inside the ear, and get that out. That's a good boy. You're doing good. You want to eat? You don't eat that? That's a good boy. You have that. When you get to a point of diminishing returns or you have a streak of blood, that's when you stop, okay? For his ears, and because he jerks, I'm not going to use a long tip cotton applicator. Once I've gotten to diminishing returns though, I'm going to medicate the ear. For him, we use Trazodone right now. So I'm going to take the top off. I'm going to peel the ear flap back and directly into the ear canal. I'm going to apply 1, 2, 3, 4 drops. I know, good boy. I'm going to massage the base of the ear to distribute the ear medication. Okay. And he's all done. Okay. For scaling with an ultrasonic or a piezo scaler, what we're going to do is we're going to take the lateral surface of the scaler along the tooth, and we're going to spend about 2 to 10 seconds per tooth scaling off the hardened calculus and the tartar. And I'm going to use my foot pedal to start the scaler. And we're just going to spend, like I said, 2 to 10 seconds. We're only going to use the lateral surface of the scaler. Using the tip of the scaler can harm the tooth and do damage. We don't want to spend too long on each tooth because it can overheat. You want to make sure that you have appropriate amount of water flowing from your handpiece as well. If you don't, then that can also cause it to overheat and cause damage to the tooth, because the tooth is a living part of the body. Okay, the other thing you can do is if you have hardened large pieces of calculus and tartar, you can use a tartar grabber, and you can use that to get those pieces off to expedite the scaling process and eliminate some of the time spent on each tooth. The other thing you can do is do some hand scaling, which I'm going to show you in a minute. Okay, so hand scaling is something that you can do to help root plane and get out the tartar and build up underneath the gingiva in the pockets. So what I'm doing is I'm taking my first tool and I'm getting up to the point where the periodontal pocket stops, and I'm pulling out all the buildup. Okay, I'm scraping that out. The next tool I'm going to use is what I'm using on the crown of the tooth, and I'm just scraping that on the visible surface below the gum line. Okay, and you should do that until you actually hear the tooth kind of squeak. Okay, and that means that you've gotten all of that residual debris off. And you move on into the next tooth. Okay, and so this is hand scaling. This is something that can be done with every patient as well. Flush with a little bit of water and air. So when we polish teeth after we've done with all of our treatments for cleaning, polishing, x-raying, extractions, any of that, we're going to take our Prophy polish and a Prophy head, and we're going to apply it to each tooth, spending about 2 seconds, 3 seconds at about 3,000 RPM on each tooth. The purpose of the polish is so that we seal any cracks, smooth out any crevices, and also remove any remaining stains off of the teeth, and just as a nice finishing touch, and seal the tooth over, okay, at the end of the dentistry. So I'm going to go ahead and I'm going to seal this side over and clean it up. I'm going to put my mask back on. You want to make sure you're refilling the paste in your Profi cup as often as needed, okay? So if there's no paste in there, it's not doing you any good. So that's all the teeth the dog has left on the upper arcade on the left side. So now I'm going to go ahead and I'm going to remove the excess polish off with our air water combination, okay? You don't want to leave any of the Profi paste in the mouth or under the gums because that can cause some abscessing and some discomfort for the dog, okay? Alright, so that side is done. Do you need any gauze or? I'm gonna need probably some gauze, yeah. And a hypodermic needle just in case. Thank you. Thank you. So what I've done is I have my patient set up for the shot. I have the plate in place for the 404 tooth to be shot, and the plate is lined up in position for the root. I have a needle, hypodermic needle on that side in case we get both teeth. That way we can ensure that we have that one tooth marked, because that's the tooth of interest. All right. Hold on 1 second, we're shooting an x-ray. You can go ahead, go through. Go ahead. Okay, we're gonna go ahead and shoot an x-ray. Okay, Erin is clear. So we're going to take a look at the x-ray, see what it looks like. Perfect. So that's what the tooth came out looking like.